I'm going to talk about some functional imaging techniques. The first one that people may be familiar with is what's called an fMRI, or a functional MRI. And what a functional MRI does is it looks at blood oxygen levels. So it looks at oxygen usage essentially in tissue based on the flow of blood and oxygen to that area. So if a tissue is more active, let's say in your brain, if certain areas of your brain are becoming activated for whatever reason, blood will typically shunt to that area, and so you'll get more blood flow to that area, more oxygen usage, more oxygen uptake, and that will appear as a hot signal on an fMRI scanner. So typically what they'll do, there's two ways of doing this. One is what's called a resting state fMRI, and the other one's called a task-based or task-oriented fMRI. And the resting state is they'll just put you in the tube and they won't give you any typical instructions to do anything. You'll just kind of be sitting in a resting state. So whatever thought patterns emerge or whatever like that, that'll show just the different signals that are happening within the brain. Task-based is they'll actually give you, usually it's through a set of goggles or something, where they'll give you a task to do. They'll flash something and then they'll ask you, did you see this image previously? And you'll hit a button if the answer is yes. And they'll take you through a series of memory tasks and concentration tasks and executive function tasks while you're in the fMRI, because then it's looking at different activation patterns of the brain. And so with concussion, we have found, and this kind of led to some of the discovery around what's called the default mode network, which is kind of what's also known as your ego, but it's kind of your self-talk, your day-to-day. It's what allows you to be anxious or excited or depressed or have fond memories of a certain thing. So it's kind of your sense of self, your self-talk. It's called the default mode network, which has become very important in concussion. And if you're not sure what the default mode network is, I did a whole talk of it on, I think, episode 50, which is on neurofatigue and how the default mode network plays into that. But the way that we're able to visualize that is often through fMRI studies. The problem with fMRI, as you'll see as we go through a lot of these functional imaging modalities, is that it is very non-specific, meaning that there isn't a specific pattern that we see with concussion. Patients with chronic concussion symptoms look a lot like a lot of different conditions. So for example, similar findings as fMRI have been found in patients with anxiety, chronic stress, post-traumatic stress disorder, chronic pain, and a variety of other conditions. So the problem becomes if you look at somebody with a concussion or persistent concussion symptoms, and then you look at somebody that's never had a concussion but has generalized anxiety, those two will look very similar. So if we see somebody with this patterning in their brain, are we assuming this is due to concussion? Has this person now developed an anxiety disorder and that's what we're picking up? Does this person have post-traumatic stress from a car accident that originally caused the brain injury, but now they're dealing more with PTSD? Are they suffering from chronic pain? Do they have pain elsewhere in their body that's causing their brain pattern to activate in this way? We don't know. So that's what makes it challenging for using any type of functional imaging. So these are currently non-diagnostic. You can't just get a functional MRI and say, oh, here it is. This is my issue. This indicates brain injury. Really what it is, oh, this is it. This could indicate a variety of things like PTSD, anxiety, etc., etc., etc. Okay? Compared to normal healthy, yes, you might find differences, but in order to figure out what is actually causing it, we still don't know, and unfortunately fMRI can't currently tell us that.